ACR BI-RADS of 2025 and breast silicone implants. At RSNA 2025 in Chicago, the American College of Radiology presented the new version of the BI-RADS lexicon, V 2025. At first glance, the question arises regarding the lexicon. Is the American College of Radiology being negligent in its approach to silicone breast implant illness? The answer is no. This is the new version of the BI-RADS lexicon, V 2025, which replaces the 5th edition. The scope of the Breast Imaging Reporting and Data System, BI-RADS lexicon, developed by the American College of Radiology, ACR, is to provide standardized terminology and reporting guidelines for breast cancer screening and diagnosis. The core purpose of the BI-RADS lexicon is to standardize reporting, facilitate communication, enable outcomes monitoring and auditing. In the US, the FDA also recommends that asymptomatic patients with silicone implants undergo imaging to detect silent rupture using ultrasound or MRI 5 to 6 years after placement, then every 2 to 3 years. The ACR appropriateness criteria now has similar recommendations for imaging asymptomatic patients with silicone implants for silent rupture. However, a 2020 study of US plastic surgeons found that most did not recommend imaging in this scenario. However, this article is outdated because it predates the FDA's 2020 guidance on the black box and the complications inherent in implants. In the breast implant section of V 2025, the BI-RADS implant section lexicon recommends that the MRI be performed without the use of contrast. If only a non-contrast examination is intentionally performed, no BI-RADS assessment is given. This is because BI-RADS assessments reflect probabilities of breast cancer, and currently, the detection of breast cancer requires contrast. A deviation in the purpose of the lexicon is observed when changes related to breast implants are added to the breast cancer screening lexicon, scope creep. Scope creep causes an imbalance between the initial scope and the outcome, with an increase in false positive results and a consequent worsening in breast cancer screening audits. The lack of specific and dedicated tools for classifying implants has consequences, impacting the diagnosis of breast implant illness and preventing the classification of complications in fibrous capsules. In addition, it underdiagnoses local, regional, and systemic findings. Under the current classification proposed by the lexicon, patients invariably receive a report of regular implants, thereby undermining complaints related to silicone implants. Consequences. The V 2025 lexicon ignores 1. Gel bleeding. 2. Silicone-induced granuloma of breast implant capsule, SIGBIC. 3. Fibrous capsule contracture classification. Scope creep causes an imbalance between the initial scope and the outcome, with an increase in false positive results and a consequent worsening in breast cancer screening audits. Scope creep is undesirable and should be avoided. So, answering the initial question again, is the American College of Radiology being negligent in its approach to silicone breast implant illness? The answer remains no. But what are the impacts of a negative MRI in breast implant illness? Undermines the clinical symptoms, considered as psychosomatic, delays diagnosis, treatment, and healing. Why is the SIGBIC diagnosis relevant? Confirms gel bleeding, shows an active inflammatory process, evidence of fibrous capsule disease. And what is the solution for diagnosing implant-related complications? The solution is the use of a lexicon dedicated to silicone implants. In 2024, we proposed a dedicated lexicon to describe and classify changes in silicone implants. The lexicon enables the investigation of gel bleeding and the quantification of inflammatory changes at the implant site. The implant lexicon must be independent of the BI-RADS lexicon to avoid contaminating the results and audits. The proposed lexicon is available on the website implantlexicon.com with free access. The printed version is available on amazon.com.